My name is Jeff Morgan. I am from Dallas, Texas. I am going to talk one final time here before it gets too dark tonight. This is going to be about the business records, the medical records that accompanied Mr. Younger's filing in his writ of mandamus. And I do have a business records affidavit here. It's signed by Emily Smith. Emily Smith being of sound mind, capable in making this affidavit. Basically what she swore is that the records that she gave were records that were kept by me in the regular course of business. This information contained in the records was transmitted to me in the regular course of business by an employee or representative of 18 and under MD who had personal knowledge of this information. Anyway, basically what she's saying is that all of these things that I'm going to tell you are true. Now, I want to talk about this here because I believe that Dr. Jennifer Marie Pape of Flower Mound, Dr. Jennifer Marie Pape of Flower Mound has falsified medical records, and I'm going to go into this right now. The first medical record comes from May 18th, 2017. This is Mr. James Younger. Mr. James Younger, it's an office visit, May 18th, 2017, date of visit, down here. And in May 18th, 2017, she says this: 5-year-old male is here today for a chief complaint of well child. So this was a well child visit and some type of a sinus infection. But what I wanted to note was this, is that she said that it was a 5-year-old male. 5-year-old male came into the office. And basically she also has this down here, says that the patient has been identifying as a girl since 3 years old. Of course, she's getting this from the mother, right? So amazing how that's gonna work out there. Started as a preference for and asking about girls' toys and dress-up clothes, asked to wear blah, blah, blah. It goes on and on and on. Says parents are divorced and have a tension-filled relationship. Actually, the parents were not divorced. Their marriage was annulled, and I believe illegally. I believe it was crooked as can be. Again, this is not a correct fact, but most people don't know the difference between divorce and annulment. Obviously, Jimmy Blacklock, the Supreme Court Justice, the clueless Jimmy Blacklock, did not know about that either, evidently. Do not communicate well with one another, and part of the reason being is that because the mother was trying to tell the boy, the father's biological son, that he was a girl. And again, I want to note once more, the mother is a non-biological mother, not the biological mother. She carried him, I believe, but she was the non-biological mother. It was not her egg, it was his sperm. Mom has primary custody, and when at her home, she allows basically the boy to do all of these girl things and addresses the girl and acts as a girl and maybe even encourages him to do so. If you go into other things, it would appear that she was almost brainwashing him to do so. Dad is very opposed to this and will not allow him to dress in girls' clothing while at his house. And that was actually not true, because there were girls' clothes in his house, and James threw them out, threw them in the garbage, because he did not want to dress as a girl. Threw out the dresses, threw out the panties, everything like that, threw them in the garbage, got up at night, threw them in the garbage, did not want them. So Jennifer Pape right here is actually telling a mistruth, but maybe she didn't really know about that. Anyway, she uses the pronouns he. On May the 31st, 2018, 1 year later, James Younger, it's an office visit of May 31st, 2018. We have Mr. James Younger. He is a 6-year-old male. 6-year-old male today for the chief complaint. There is no chief complaint on file, actually. He shares rooms with his twin brother. They have bunk beds, still referring to self as a female, using feminine pronouns, calling himself sister to twin brother, dressing in girls' clothing. We have no idea how much of this was really James doing this and how much of this was the mother brainwashing him or maybe forcing him to do this, because this did not take place when he was with his father. Did not take place at all. In fact, he loved being a boy. He did engage in boy things, wore a suit and a tie, got boys' haircuts, told his father he wanted to be a boy. I did not like to be seen around his father wearing girl stuff. The problem list is gender identity disorder in pediatric patients. So this is a disorder. She's claiming it. This is what she's writing down. It's a disorder, transgender. There's other things down here. He's living with his mother, which is the problem right there in itself. Mom with primary custody, dad with visitation rights. And that is also another tragic event of our courts. On August the 1st, 2019, a little bit over a year later on, the office visit down there. Now we no longer have a 5-year-old male or 6-year-old boy. We have a 7-year-old child that's here today for the chief complaint of well child at 7 years old. So it's a well child visit. He was attending the Genesis Clinic at UT Southwestern, UTSW, for transgender/gender identity. will plan to see endo in 2 to 3 years for hormone suppression. So here he is, 7 years old, and in the medical records it states, Dr. Jennifer Marie Pape has given the record that says basically that James Younger is already going to UT Southwestern, going to their Genesis clinic, which was a clinic that was designed to basically convince people to become transgender. And in 2 to 3 years, they will be taking them over to look at hormone suppression, puberty blockers. This is what was taking place at age 7 years of age. And as you read further down here, as the description, because we already said that it's James Younger is his name, we do have down other things. She has no known allergies. What is this pronoun she? Dr. Jennifer Marie Pape is now using a new pronoun for James. Instead of he, as it has in the past, it is now she. But she also says here further that this is a gender identity disorder in pediatric patient, transgender. But once again, she keeps using the pronoun she. Physical examination, constitutional. She appears well-developed and well-nourished. She is active, no distress. And what I want to know is this, because at this point in time, James still has a penis. And I'm just wondering if Dr. Jennifer Marie Pape would tell us how many girls she examines that have penises. And James did not have a vagina, and I'm just wondering how many girls that she's examined don't have vaginas. I just am very, very curious about this. Neurological, she is alert, she has normal strength, she displays normal reflexes, blah, blah, blah. This is Dr. Jennifer Marie Pape, and I believe that she's falsified these records. Luna Younger. Wait a minute, is there a legal document that calls his name Luna? There is no legal document that calls his name Luna. So here she incorrectly puts his name down there as Luna. It's an 8-year-old female. So in the records right here, she has now changed him from a male to a female. And I just am wondering how many boys actually automorph into a female? Has this ever happened in history before? Why is Dr. Jennifer Marie Pape saying that Mr. James Younger, is now a different name, which is not his legal name, and is now a female? The problem lists priority. He refers to himself as a female, has female disorders, stuff like that. But the other thing that I find very interesting, that if you look at the growth charts, she's using male growth charts, boys growth charts. These are growth charts, statute for age, percentile for the boys, ages 2 through 20, and she has changed James's name to Luna. In the past, it used to be James. Now we have Luna, supposedly a girl, a female, but she's using boys' growth records on this Luna, this fabricated person that's in place here. These medical records that claim that James is now a girl. I believe that Dr. Jennifer Marie Pape has falsified medical records intentionally to help her friend that she has known for these 4 years or so, Dr. Anne Georgulas, to help her transition James. I believe this has been a planned thing, and I believe that Dr. Jennifer Marie Pape ought to be reported and investigated for falsifying medical records. I don't know how to do this. I filed some things in the past. This is what I don't know how to do. If you are in the medical profession, I think you should be taking note of this. This is a disgrace and a discredit to your profession if you permit this to take place. So if you're a doctor, I'm hoping that you will take this and that you will actually file complaints against Dr. Jennifer Marie Pape. Dr. Jennifer Marie Pape of Flower Mound has falsified medical records, in my opinion, and I believe she should have her license revoked. And I believe also too that Anne Georgulas, who failed to report is also an action. She should have been reporting Dr. Jennifer Marie Pape for falsifying these reports. She did not do so. I believe her license as well should be taken away. I believe also too that the whole custody situation should be reversed, that both James and Jude should be given to their father. I believe custody should be flipped 100%. This has been a disgrace to the state of Texas. Our Supreme Court, Jimmy Blacklock, Clueless Jimmy, and Compromised Evan have authored opinions and affirmed opinions that are disgusting and reprehensible beyond belief. Only one person stood against it, John Devine. Anyway, that's it for right now. It's getting too dark, so that's it for right now. I do hope that somebody does follow up and files medical complaints against Dr. Jennifer Marie Pape of Flower Mound. Thank you.